Hey everyone, welcome back to the PAH Podcast. Today we're going deep into the epidemiology of obesity, and that means how we define it, how common it is, and what's driving this global rise. We'll look at the data, the trends, and all of the environmental factors that make this one of the biggest health challenges of our time. So grab your coffee or maybe your protein shake or whatever, and let's jump right in. So, how do we define obesity? When we talk about obesity, the first question is, how do we define it? And that's going to be important. The most common tool is BMI or body mass index, which is weight divided by height squared. For adults, it's simple. Your normal weight is 18.5 to a BMI of 24.9. If you're overweight, your BMI ranges from 25 to 29.9, and obesity class 1 is defined as a BMI of 30 and above. That's broken into classes 1, 2, and 3. And for kids, it's trickier. Their BMI changes as they grow, so we use age and sex-specific percentiles. Now, overweight is the 85th percentile and above in kids. Obesity is the 95th percentile and above. And because severe childhood obesity is now so common, the CDC had to extend growth charts all the way up to the 99th percentile. And that says a lot about how much things have changed over decades. So what are the trends over time? If you zoom way out, humans used to maintain an average BMI of around 22 for most of history. So that's not too bad. But starting in the 1800s or so, BMI began to climb sharply. Looking at US data, obesity rates started to surge in the early 1980s. And in 1990, most states were below 15%. So that's not bad at all. By 2022, every single state was above that. And several states like West Virginia, Louisiana, and Oklahoma are at the top right now. Both men and women show steady increases, and severe obesity is defined as a BMI of greater than 40 and up, is rising fastest of all. Now let's look at the global patterns. This isn't just an American issue. Globally, obesity rates have tripled since 1990. Specifically in regions like Polynesia and Melanesia, the rates there are among the highest in the world. By 2030, half of the world's adults are projected to be overweight or obese if nothing changes. Let's talk about the socioeconomic and demographic factors now. Who's most affected? In high-income countries, lower-income groups, specifically women, have higher obesity rates. But in low-income countries, it flips. Higher income means higher obesity. In the United States, Black and Hispanic populations, both adults and children, have a higher prevalence than white or Asian groups. Let's talk about the CDC map story. If you've seen the CDC's obesity maps, they tell the story visually. In 1990, the map was colored light blue. All of the states were colored in blue, and they all had less than 15% obesity. In 2022, none of the states were colored blue, and everything was deep orange and red across the entire map. And in just one generation, obesity spread from coast to coast. Isn't that remarkable? What about childhood obesity? Back in the 1970s, about 5% of children, US kids specifically, were above the 95th percentile for BMI. Today, roughly, it's around 20% or so. So that's grown as well. Severe obesity in kids has jumped to nearly 25% since 2007. When researchers compared BMI to DEXA scans, which measure body fat directly, they found the same trend. So guys, this isn't a measurement fluke. Kids are truly gaining more body fat. Globally, the pattern is the same. Thinness is declining, obesity is rising, especially in Polynesia, Melanesia, and South Asia. Let's talk about gender and age. Across most of the world, women have had higher obesity rates than men. Prevalence peaks between ages 50 and 65, then levels off a bit with aging. The key point here is obesity touches at every stage of life, but not equally. A word about socioeconomic status. Across nations, one study looked at children from 12 different countries in wealthy nations, and higher income meant a lower BMI. In poorer nations, higher income meant a higher BMI. So the relationship between money and obesity is cultural, not universal. It's important also to talk about inactivity and diet. Let's talk about movement and food. Maps of physical inactivity look almost identical to obesity maps. States like Louisiana, Arkansas, and West Virginia top both. Non-Hispanic, Black, and Hispanic groups show higher inactivity levels than whites. Diet quality is just as concerning as well. The average healthy index score in America is about 51 out of 100. So we're basically halfway to ideal and flatlining. A word about ultra-processed foods. Ultra-processed foods such as chips, sodas, packaged snacks are everywhere. People who eat more of them have a 26% higher risk of obesity. In one lab study, participants on a processed diet ate hundreds more calories per day and gained a kilogram in 2 weeks. Meanwhile, those on an unprocessed diet lost a kilogram. And that's how powerful our food environment is. Now let's talk about the built environment. Look around your neighborhood. Is it walkable? Are there parks, sidewalks, grocery stores, or just fast food chains? Research shows these factors do matter. Not huge effects, but consistent ones. Communities that have more walkability and green space tend to have lower obesity rates overall. An important thing to talk about is air pollution and obesogens. Here's something new. Air pollution studies suggest that higher pollution levels are linked to greater odds of obesity, especially in kids. Now, the data is early, but it's growing. And then there are obesogens, which are chemicals that disrupt hormones and metabolism. They can also increase fat cell number and alter how fat is stored, and potentially affect future generations. More than 50% of these chemicals have been identified. It's a reminder that our environment is literally reshaping our biology. Now, why does this all matter? Obesity isn't just about a number on a scale. It's a driver of diabetes, heart disease, liver disease, and certain cancers. And because rates have risen so fast, it's clear that the main drivers aren't genetics, they're environmental. So the solutions must also be environmental too. Policy changes, better food systems, and safer spaces for movement. So let's recap. Obesity is defined as a BMI greater or equal to 30 in adults and greater than 95th percentile in kids. Number 2, rates have skyrocketed since 1980. Number 3, childhood and severe obesity are rising fast. Number 4, thinness is down. Obesity is up worldwide. Number 5, the drivers are behavioral, environmental, and chemical, not just personal choices. Number 6, health equity matters. Some groups bear a heavier burden than others. So where do we go from here? We start by changing the conversation. Obesity is not a failure of willpower. It's a complex, chronic disease that demands compassion, science, and support. Let's create environments that make the healthy choice the easy choice. Let's educate, not shame. And let's work together to reverse the trend, one community at a time. If you found this episode helpful, share it with someone who cares about health and wellness. Subscribe to the Dr. PAH Podcast for more evidence-based discussions on obesity, nutrition, and longevity. Remember, it's not about perfection, it's about progress.